Hello students, we will discuss a common thing currently at least we see regularly in most of the hospitals and setup because this is becoming more and more common. We will just see, then we will come to know what exactly it is. So what this condition is, look at this here. There is a scar here, left arm, that's the point, very important. Left arm, there is a scar here and there is a swelling here. So what it could be is the thing which you have to remember. So it is AV fistula done for CKD, chronic kidney disease, for regular hemodialysis. You know that CKD, chronic renal failure, is the older terminology, and AV fistula is a common thing which is required for regular hemodialysis, at least until patient goes for a formal renal transplantation, and usually done in the left hand, and many times in the brachial regions, radial, cephalic, different areas they will do it, usually as vascular surgeons, urologist, even general surgeons with the experience of vascular anastomosis also will do the AV fistula. But problem is maintaining the good fistula track with the thrill on palpation, bruit on auscultation, with the articulation of the venous system, and profound hyperdynamic circulation which is needed for rapid flow of the blood across hemodialysis unit. But again, complications you have to keep aware of in these patients are thrombosis, failure, and bleeding, sepsis, aneurysmal formation. All the things are complications which we come across regularly, because more and more hemodialysis patients are coming, and more and more AV fistulas are done commonly in even smaller centers. It is becoming done, and setups are available for hemodialysis in most of the centers, even in taluk headquarters currently. So that is why you have to remember as a clinician how exactly it looks. Left hand is a common site. If left hand failure, then right side they will do, and different location they will do. What are the features? CKD patient for regular dialysis usually done left upper limb. This point is very important. You have to remember. Vascular surgeon will do the procedure done under local anesthesia usually. Clinically, there will be thrill on palpation, bruit, hyperdynamic circulation. This is what you want to achieve, so that you can perfuse the dialysis unit very rapidly to have a proper dialysis. And thrombosis, failure, aneurysmal formation, torrential bleeding, also already I have discussed. That is these are the complication. This is, we have to remember always. Typical thrill, wherever you see such patient, feel thrill and auscultate for breathing, and remember the complications. So students, so for detail about these things, how to examine vascular malformations, AV fistulas, thrill, bruit, continuous murmur in these patients, go through my clinical examination, current edition, with the video examination lectures, and SRB manual of surgery, in details test about all topics, including specialty, urology, cardiothoracic, neurosurgery, then instrument X-ray, specimens, operative surgery, basic of course, surgical operations, in detail surgical procedures of all things, A to Z, everything in detail, including abdomen, GI, it is there. My tissue approximation atlas is good with the video of how to suture the different methods, suturing different methods. My Diginor lectures covers everything for CBME. For 1 year you can subscribe and go through that and have the entire knowledge of the surgery, including clinical examination, text, and of course with operative surgeries, X-ray, specimen lectures, everything in detail, covering the specialty basics also for undergraduates. So students, I hope you understood this brief lecture. Thank you very much.